welcome back to Ahead of the Curve. I'm your host, Dr. Megan Teed, and I'm here with my friend, Dr. Laura Glazebrook, fellow scolio warrior, scoliosis specialist, and we're here to give you an update on our tongue tie release experiences. Welcome back, Dr. Laura. It's good to see you.
Thank you. It's good to see you too on the other side.
Yes, yes. Yeah, so just kind of as a little refresher, I had Dr. Laura on several episodes back, and I should have looked at what specific number that was so you guys could refer back to it. But we were talking about all things spinal fusion, pregnancy, anything pelvic floor, and we also briefly touched on Dr. Laura's tongue tie, which she kind of opened a whole world to me during that conversation. So refer back to that episode if you want to do a little catch up.
It's episode 56.
Oh, there we go. Thank you.
The only reason I know is because I have a link in my bio for it. So I was just like, oh, bloop.
Yes, yes. So Laura, can you just briefly tell us a little bit, actually, you can tell us as much in depth as you would like, a little bit about your decision to undergo this tongue tie release and how you discovered that you had one.
Yes. So my story, I feel like within the tongue tie community, at least the one that I've been following, a lot of people, especially like parents or moms, like I had no idea. I didn't even know anything about tongue tie at all until my daughter was born. So I have two kids. My oldest apparently also had a tongue tie. He was just more chill. So it was never a thing that I needed to worry about. My daughter, though, she was born in 2020, like literally a month into the pandemic, and she was having the hardest time with nursing. She wouldn't sleep. She was crying. She wanted to nurse all the time. And I had, another child. And so I was like, this doesn't feel normal. This feels like this is like, a little bit too much. And so I honestly didn't really know where to turn. So I found a lactation consultant because one of my goals for her was to breastfeed, because there's a lot of like health benefits. And now I know like facial, jaw benefits to like nursing and breastfeeding. So that was my goal. And so I spoke with a lactation consultant who did an assessment virtually, of course, and said, it looks like she has some like ties, like a tongue tie and some lip ties. And that's probably one reason why she can't eat. She can't like suck effectively. She can't get good food. So she's hungry. Her little nervous system is like really, really wound up, and she's just really unhappy. And of course, just because I literally just had a baby and it was a month into a pandemic, like we were having a hard time here in my house. And so I started the process of trying to get her taken care of. So I did, some research into tongue tie release and what that looks like for babies. And one of the providers who ended up doing the release for my daughter, I just had them look at me. And they were like, oh yeah, you have a severe, like you have a lip tie and a severe, like a grade 4 or a class 4 tongue tie, which is like 5 is like you can't move your tongue at all. So I think the reason I'd asked them to check was I had noticed part of my journey was, even though I have like a more like a severe scoliosis and a fusion, I never really had pain or anything, but I've always had headaches my whole life. And I've always ground my teeth at night. Like I'll wake up, and you can tell on my bottom teeth that they're a little bit ground down, because literally all night I'd be grinding my teeth. So I'd have like a bite guard, but nobody was really able to give me anything other than, just wear a bite guard. But I noticed around that time when all that stress was happening, I was having a lot more, not only headaches, but also like I was noticing a lot of bite changes, like more of the pressure was going on to my right jaw versus my left. And so it was about this time that I kind of plunged head deep, or curve deep, I guess, into this whole world of, okay, what is what is this tongue tie? What do I need to do to get it resolved? And it turns out that I actually also had like a smaller palate and a smaller jaw. So I started the process to get myself expanded. So I started palatal expansion, and I did a round of that in preparation for the tongue tie release. Apparently, I wasn't fully expanded. Sorry, when I had my first release done. And then I had some scarring after my first release. Although I noticed when I had that first release, my pain went like way down, and it was amazing. Like my headaches were much better. I was sleeping better. And so that was in 2021. And I, in the meantime, have kept expanding my jaw. And I just had my second and hopefully final release about, I guess, a week after yours.
So the first release, you said you had some scarring that happened. I mean, scarring is kind of like a natural thing to happen. So what prompted you to have that second release done?
It's a great question. I think, I've been trying to figure all of that out and figure out why all of it happened the way that it did. I think part of it was there wasn't quite enough space in my jaw, or sorry. Yeah. My tongue didn't, sorry, that's my dog.
I know.
There wasn't enough space in my palate, so my tongue didn't sit quite in the best possible spot. And then on top of that, I had just with anxiety, I was like probably wasn't doing quite as much stretching as I needed to. And I think a lot of my like how I was holding my tongue probably wasn't ideal. So I think those things really kind of contributed to that.
Mm-hmm. Gotcha. I'm just going to share a little bit about, my experience, what led me to getting my tongue tie released. So after my conversation with Dr. Laura, I was like, okay, this makes a whole lot of sense. So let me try to put some of these pieces together. And, I was reading blogs, I was reading some research, I was on all these myofunctional therapists, Instagram, podcasts, all these things. Myofunctional therapies, mouth therapy, essentially. And I just saw how things could not be connected. So, I did my little own screen on myself, and, I couldn't do certain things, such as have my whole entire tongue sealed to the roof of my mouth. And I knew that I was a mouth breather, especially at night when I'm sleeping. I wake up with persistent like dry mouth. And my husband says I snore on occasion, which I don't know if I believe. No, I'm just kidding. And then also I have persistent upper trap tightness on the left side of my neck, and that affects the symmetry of my movement, of just the way that things appear. And also I get a lot of like clicking at the left side of my jaw as well. So thankfully I don't experience that the headache aspect of things, but I know that things could lead into that with this stuff that I have going on. Additionally, I also read some parents' experiences of their children having scoliosis, having tongue ties, getting the release done, and their curves reducing after they had those procedures done, in addition to like body work and scoliosis specific exercises. So, that really piqued my curiosity as well. So that's what led me down this path. And I had my release, I guess it's just over a month. I had it done the day before Halloween. So yeah. So just kind of You mentioned that your headaches are way better as after you've had your release done. Your sleep is improved as well. Is that right?
Mm-hmm. Yeah.
Um, yeah. And what about your anxiety levels since you've had?
I have been working, that was one of the big things. One of the things that I feel like I tried to do a better job of this time. Sorry, my dog again. Sorry for the clicking noises. um, I did a much better job this time of um, getting the body work in. And because last time, I don't know that I really prioritized that as much. And I think I actually worked on my anxiety and nervous system a lot beforehand for this release, which I feel like really made the difference for me.
Mm-hmm.
Um, I will say too, and it's funny you mentioned the scoliosis aspect. I do think one of the reasons I decided to get the second release done was because I thought, well, if there's anything else I can do to like prevent my curve from getting worse over time, or even, hopefully like get me into a better alignment, I certainly wanted to do that, because I think I mentioned it the first time I was on, but I could feel there is more restriction on the right side of my
Mm-hmm.
tongue. And I felt it a little bit again, not to the extent that I felt it the first time, but when they were doing the second release, I felt the same sense of release on the right side. And I could tell just where the dentist's hand was, I could tell that it was the right side. But and I was like, you know what? Yep, more tension on the right, curve on the right.
Yeah, same here. Yeah.
Yeah.
And it's actually even in post-op, I'm noticing that's the side that wants to keep tightening up more so
Mm-hmm.
than my left side. So I'm doing craniosacral therapy in
Love it.
addition to my myofunctional therapy. And she actually has like special training to be able to do some stuff inside the mouth. And she like can see it and she can feel it as well. And when it releases, it's just so crazy. It's so crazy how you can just feel it release. And afterwards, I feel like the rotation in my back is so much better than, before I get that work done. So there's
Yeah.
definitely a correlation there.
Yeah. I have no idea what your experience was in PT school, but I feel like I kind of didn't really have an appreciation for the face, like the muscles in the face and the upper neck. Like maybe we covered them. I
Mhm.
had no idea about the referral patterns. Like we didn't really talk about the fact that, yeah, those cranial bones, they're supposed to move. And it's like, there's this giant gap in my brain of knowledge that, maybe they did talk about it a little bit in PT school and maybe I just blocked it out, or maybe they never covered it. But every step of this process, when I've seen different people, osteopaths or PTs with different training in, like the cranial bones, it just blows my mind. And I'm just like, how is this such a gap in my knowledge base?
Yeah, I mean, I feel like in physical therapy school, their main goal is for us to be able to pass the exams.
Sure.
So the
Yeah.
boards. I almost said bar. I'm like, that's not right. The board.
It's very early on a Tuesday, so I understand.
So we get like a lot of information, or so we get a little bit of information about a lot of things. So like going into depth into any of these aspects, like, scoliosis is kind of glazed over. What you're
Mhm.
saying about the cranial bones is just glazed over. So we get enough information to, I think, be dangerous. And then when we
Right.
get into our clinical experience, that's when we're supposed to, really dive deep and
Right.
kind of get more specialized in some of these things. But yeah, I'm like you, I don't remember learning any of that stuff in physical therapy school at all. It's kind of
Yeah.
like you got a dump.
Yes, exactly.
Oh, so as far as your pre-op therapy, I know that a lot of people in just general physical therapy, they don't see the need for pre-op therapy. They just want to get the surgery done and then do whatever they need to do afterwards. what was your experience like with pre-op, and why do you think that that's so important?
Oh, I mean, I have seen this now from multiple angles. I saw it from my daughter, she was an infant when she had her release done. She wasn't really a newborn at that point, but we had one provider here in the Atlanta area who just released her that day. And then I asked kind of like, what should I do for follow-up? And offhand, he's like mentioned an occupational therapist. And so we had that healing experience was not super great. So we planned another release for her where we did do body work before. So we had OT, I had her do craniosacral, and I still can't really explain exactly what craniosacral is, but whatever magic they can do took my very fussy, very angry baby from like this little ball of nerves to like a sleeping child. And she would sleep for hours after craniosacral. And so
Huh?
I, I was telling my husband earlier on in that process, like, I don't know what they're doing, but it's working for her, and I will pay whatever it costs, because she
Mhm.
didn't sleep well. She was very, easily startled. And now, knowing what I know about the vagus nerve and that tongue posture and the nervous system, of course she couldn't sleep very well.
Mhm.
But so like coming back to how that kind of shaped my experience a bit, I think the first time, like I mentioned, I did a little bit of body work before and after, but I think I could have varied my approach a little bit more. So this time I actually worked with an osteopath before the procedure, and also another PT locally here he's got some training, like kind of craniosacral training, but he works more with like muscle energy of the muscles in like the face and the neck. And he knows how to get a little mobilization of like the cranial bones, which again, like I
Mhm.
don't quite understand, but it works. So I was all in for that. And ever since the first release, I found an incredible massage therapist here in the Atlanta area who does really great work on like TMJ. So she'll do intraoral release,
Nice.
and a lot of release on like the face and the head and neck. And in the meantime, I've kind of coached her and her team on what to address for people with scoliosis. And so I have stayed working with them for quite a while. So I did sort of a combination of an osteopath visit, a couple of sessions of PT, kind of to work on the detorsioning within like the face and the head. And then I pretty regularly saw my massage therapist, and I did a lot of my own. Of course, I did my exercises, like my myofunctional therapist wanted me to do, try to stay really consistent. I really prioritize doing my own like release of my tongue. So I'd like wash my hands, get my own fingers in there, and really try to like massage under that tongue. And so I did all of that kind of as preparation. And then I pretty much the day of the surgery, I started doing some gentle stretches and tried to, do all of that, like get on top of that ahead of time, because I had that first experience of things kind of scarring down. So
Mhm.
I've
Yeah.
been very compliant with my exercise.
That's great. Yeah. I I didn't have the experience, of having a first release done. But just through talking to you and you telling me that you needed to get that second one done, I just really felt like that myofunctional therapy was a really important element. I did not do any of the body work leading up to that. I was in a functional neurology mentorship. Um, so that's learning about how your cranial nerves impact your pain levels and the symmetry and balance, the way your brain functions um, overall, and it helps with nervous system stuff as well. So I was kind of self-treating through that mentorship that I was going through. And I think that helped me a lot, especially post-op, because I I don't know what I was thinking, but I was like, oh, this will be like pretty simple. I could see like I had a couple of patients on my schedule for the afternoon after my release. And I got out of my release, and there was just no way that I would have been able to do that. I was in more pain than I thought I would be in. Not to scare anybody, but I'm just trying to be realistic, so that people know that it's not easy breezy.
Mm-hmm.
And I wasn't able to do really any exercises at all with my tongue that same day. So I was trying to move it as much as I could, but um, the thought of stretching anything that day was out of the question.
Yeah.
So yeah. And I just doing the stretches and things since then. So like 5 times a day, stretching that tongue and doing my own self massage. I could see how that has been like a big help in maintaining the length, because it still feels like it wants to continue to want to tighten up.
Yeah.
I don't know if that's your experience, Laura.
Yes. So one thing that I realize at this point, I'm kind of, I guess a veteran, a tongue tie veteran. I don't know. Like my daughter and actually my son got a release too. So my whole family is tongue tied. But so what I learned is, they had me take, like, literally before I even, like, while they had the local anesthetic in, they had me take like a pain pill, or just, I mean, it was over the counter, but like a stronger Advil, that would be on board before before that anesthetic wore off. And that is one thing I did not play. The second like the alarm went off for like 2 days, like every, whatever it was, 4 to 8 hours, I would take another just like Advil or something to try to keep that pain down. And I did feel a lot of soreness, just especially because for me, like everything in the back of my tongue was so bound down. I felt a lot of soreness for probably a good, I mean, 4 or 5 days afterwards. Like when I was eating, like I would feel some soreness. But as far as post-op pain, I managed to keep that under control, but I think only because I was taking that medication. And also my provider gave me, I don't know if you can see this, I'll say there's like, it's a pain relieving gel. So it's basically, it tastes like peppermint, so it's not too bad. It's a homeopathic, like an oral gel that you can put like literally on the muscles. So when I would do my massage very early post-op, like I would make sure to not go anywhere near like the actual sutures, because you're not supposed to touch those because they're supposed to heal. But on
Mhm.
the muscles surrounding, I would, put a little bit of this on my finger, and I would just do a little gentle massage through there. And I think that actually helped me a little bit as far as keeping things moving. And it was just it kind of felt nice when I was doing my stretches, and then you'd get like this nice little peppermint taste in your mouth. And so
Yeah,
it was lovely.
that's great. Yeah. Um, I I made the mistake of waiting on the Advil.
Oh.
I just wasn't really like given very clear instructions about pain management from
Mm.
my surgeon, and they were kind of like, yeah, you'll be fine. And I had a vasovagal response like right afterwards. I was passed out. So it was like a whole thing.
Sorry.
So it's all good. I think,
Now,
part of
yeah.
it is you're awake when you're getting the procedure done.
Mm.
So for me, I think that was just like a little bit more trauma than, I was really thinking about, because I'm like, okay, I know exactly what they're doing right now. And, you kind of
Mhm.
have that in your mind. So your
Yeah.
body and your brain want to protect you. So that's kind of a natural instinct, I think, to have
Mm.
something like that happen. But um, yeah, after I was consistently taking the Advil, that was a game changer for me too.
Mhm.
So yeah, looking back, that's something I would have done differently, is just really been on top of that, taking that right away after the local anesthetic wore off, and then being very diligent about consistently taking that.
Yeah. Do you mind if I ask you a question? Can I
Sure.
interview you on your podcast?
Yes.
Um, I think you and I have spoken about it before, and I think we're both very aware of just like the whole nervous system thing. So I wonder, what was your experience? So obviously there was like that vasovagal, like your body had a bit of a stronger response from a nervous system perspective. And that, I mean, that totally, that happens, right? But I think I wonder, how did that, kind of color those first couple of days after? Like, do you feel like that maybe had an impact on your recovery overall, or your pain, or is that something that you've considered?
Yeah, I actually hadn't filtered it through that lens, but I do think that that had an effect a little bit on my recovery. I think um I felt like a little bit more scared. I'm like, okay, like maybe this was like a bigger deal than, I kind of had in my mind of, the
Mhm.
procedure. And, I also had the things in my mind of like, okay, well, like if this isn't supposed to be like such a painful thing, like why am I having this much pain? And,
Mhm.
some of those things were happening in my conversation I was having with myself afterwards. So I think that that probably did play a little bit of a role in to how aggressive I was with my stretching. I think I was a bit more timid
Mhm.
initially because I didn't want to have another vasovagal response.
Of course. Of course not. Of course you wouldn't.
Yeah.
Yeah. So I don't know if have you mentioned to any, like, I know you talked a little bit about like what the surgery is, but I think that's something, did we want to talk about that really quickly
Yeah.
on the
Yeah.
um so for you, I mean, I assume, did they do like the injections, like the local anesthetic first and let that sit? Um
Yep.
and then did you do the laser release?
Laser, and then they did do some clipping as well in
Gotcha.
addition to the laser. So
Gotcha.
they did clipping and then sutures
Hmm.
for,
Hmm.
yeah.
And about how long did your procedure? Do you remember how long your procedure took?
Yeah, so mine took almost an hour because they did my lip tie as well.
Hmm.
That was just late, or yeah, that was just laser that they did for the lip tie. And they didn't do any sutures for that. That one was pretty, but like I was just like, okay, that wasn't a big deal. But the tongue tie took a bit longer. And it was I had more of a posterior tongue tie, and I was a grade 3 for
Mm-hmm.
mine. Yeah. So I had to suction my tongue to the roof of my mouth the whole time, which gets to be a challenge of doing that for that long of a time when you know what's happening,
Right.
Uh, and also when your tongue is numb. I was like, I
Right.
don't know if it's actually suctioning.
Yeah.
Yeah.
Oh, yeah. Yeah, I think for the most part, there is some debate I know between there are some people that I've learned within like the tongue tie space that they prefer either, scissors or clipping versus laser. It's interesting that so they did both. I guess, if they needed to, I guess that makes sense. But when I did my research, I learned a lot about how the thing that's nice about the laser, if you have access to it or can afford it or whatever, is it helps to like cauterize, and it just allows for a little bit more of a clean, healing.
Mhm.
Um, but I've heard that there are some people that are very staunchly like, we need, we should only be using scissors. So I don't know. So
Yeah.
I think that's interesting.
Yeah, I'm not sure why they did both, but they did. I should have asked them, but they were doing a combination of it, so I'm
Hmm,
not sure.
okay. Well, there you
Yeah.
go. Um, I'm looking at our time. Um,
Yeah.
I don't know if you wanted to talk through like how to do assessments or screen, or if you want to just do like a follow-up, or how you want to do that.
Let's see. I think it'd be good to do just include that real quick.
Yes.
How to assess if you have a tongue tie for yourself. And just do a little screen on yourself. Yeah. And then
Perfect.
we'll wrap up.
Yes, that sounds good. I actually got, I'm gonna hold this up to you. I don't know if you can see. I'll read out. I got this. We had a collaborative event here in the Atlanta area for people that do that work with airway providers on tongue tie stuff. And I got this beautiful, it's like a screening tool where
Nice.
you can help screen people. And it's called Therist. So I'll send you a picture of it and maybe a link if you want to include that. And so there's kind of 6 different categories. So for anybody, even if you don't have, training, because a lot of us, like there is, as PTs, we could go and do like training on like officially doing all this stuff. I don't really have time and space for any of that right now. Don't know about you, but there's this really nice little screening tool that it's 6 questions. And so the first one is, can they breathe through their nose for 3 minutes? Yes or no? And then the second one is, so it says mentalis strain. So basically there's these muscles around your lips that, like, if you can see they're actively working to hold your mouth together, like instead of your lips being closed because your tongue is suctioned, that would be titled mentalis strain. And so that's like a yes or a no. And then there's like, can you like tonsil hypertrophy, like how big are their tonsils? So it's like less than 50% or more than 50%. And then there's like the fancy word for tongue tie, which is ankyloglossia. And so it says like not restricted, and you would like look at the motion, or restricted, so like grade 3 or 4. And then there's the 5th one is dental wear. So like, can you see actual, like grinding on their teeth, or what they call it attrition, like where they've ground their teeth down, or can you see issues with like their gums? And then do they have a narrow palate? It's like number 6. So it's like you can grade that from the, like, out of the 6 questions, how many were a yes. And then they said, you can always refer to like an airway specialized like dentist or a myofunctional therapist, and they can do more like official kind of screening. But I thought that was really cool.
Yeah, that is. Thank you for sharing that. I'll be curious to look that up myself and have access to that, because those are some things that I'm just very basically like, stick your tongue out. Can you seal your tongue to the roof of your mouth, and then kind of tongue to spot without closing the jaw at all. And that one really kind of tells you everything you need to know. I think.
Right.
At least so far, I feel like every person that, I've screened using that, and it's indicated that they probably have a tongue tie, and then they've gone to an airway specialist dentist or myofunctional therapist. They've confirmed that they have it. Yeah.
I think one of the things that I start to look at too, I have questions on my intake forms on, do you have a history of a lot of ear infections when you were a child? Or did you do speech therapy? Because a lot of people with like a tongue tie will have issues with articulation. So like for me, I was in speech when I was in, elementary school for R's and L's. And so I ask about chronic ear infections. I ask about, difficulty swallowing pills. If they have headaches, I ask if there's a pattern to those, like, are you having worse headaches in the morning? How's your sleep? And then, I'm checking, okay, can they suction their tongue up, or can they touch the tip of their tongue to the roof of the mouth with their mouth wide open, to tongue to spot? And a lot of people find it really, really hard to do.
Yeah.
So like it's really interesting to see there is a lot of kind of correlation between those of us. I think I see a lot too with like kyphosis.
Yes.
that, and I guess that makes sense because if your head is being pulled forward and
Mhm.
like they would have more issue through there.
Yeah. Yeah. Well, I'm so grateful that you have illuminated this whole world for me. And I think that, like you said, being able to tackle your scoliosis from every angle, and if there's anything that you can do preventatively to stop your curve from getting worse, like why not do it? In addition to helping so many other things in your life with your breathing and anxiety and all those things as well. Why
All
not?
the things. Yeah. I'm so glad that, I mean, I hope that it's been helpful for you. I mean, for me, I'm so glad that I did it and I feel much better. Like my neck feels much, looser.
Yeah.
So yeah, I think I hope that this has been helpful for people. I know I have people ask me all the time, like on social media, like, tell me more about that.
Yeah.
I'm sure
Yeah.
you do too.
Yeah. It's definitely been really helpful for me. And I think the biggest thing for me, it's been helpful for my neck mobility and my anxiety. Like I feel an immediate like relaxation happen when I'm able to keep my tongue in that position, sealed to the roof of my mouth. And I was never able to get the back of my tongue up to the roof of my mouth. So like
Yeah.
experiencing that for the first time in 38 years was something else.
Yes.
Yeah. Um, well,
Well,
thanks again for coming on, Dr. Laura. It's always a pleasure. And I'm sure we'll do another episode or 5.
sure. I know. I all day long. I'm gonna come see you in person at some point.
Yes, yes.
Can you show me your suction hold?
Oh, sure. Yeah.
I'm just gonna take a screenshot. Got it. Looks good.
All right. Well, thanks again. And until next time, take care and stay ahead of the curve.